Hello everyone, I am Salcedo. Our topic for today is about local anesthetics. This discussion contains 5 parts. First is the introduction, mechanism of action, structure and chemistry formulation, pharmacokinetics, organ toxicity, examples of local anesthetics, adverse effects. What is local or regional anesthesia? It is a state characterized by reversible loss of perception of pain or other motor response to stimuli in a local or regional part of the body and is not accompanied by a loss of consciousness. How about local anesthetics? Local anesthetics are the weak bases that block nerve conduction and cause reversible loss of sensation in the part supplied by a nerve. Advantage of local anesthesia. Animals don't lose their ability to ambulate. Avoidance of changes in physiology. Preemptive local anesthesia in animals undergoing general anesthesia will reduce the amount of general anesthetic, minimizing the cardiopulmonary depression that may accompany and also leading to quicker recovery. It provides a useful pain relief even beyond the full recovery from general anesthesia. In some situations, with extremely depressed animals, when they will tolerate performing a surgical procedure under local anesthesia may be safer and also it is more economical. So this is Russian surgeon Leonid Rogozov. During an expedition to the Antarctic, he became seriously ill. As the only medical practitioner in his team, he performs a self-operation under local anesthesia. Cocaine is the first local anesthetic to be discovered. The addictive nervous system actions of cocaine were soon discovered, but it was still used until procaine was synthesized. Lidocaine or lignocaine is probably the most used agent today. So let's move on to the mechanism of action. So we already know that local anesthetics block locally neurons and numb neurons. They work mainly on the afferent neurons so that they prevent a pain signaling from getting to the central nervous system that you feel pain. We must remember that local anesthetics are weak bases. So how do local anesthetic work? How do they numb the neurons? They act by blocking the sodium channels. This shows the equilibrium equation, and as you can predict, only the non-protonated, which is a non-charged form, is going to be able to pass through a lipophilic membrane. Within the cell, the pH is slightly more acidic, so we're going to have some protonation and therefore going to get some charge formed. And now, the important point is that only the charged local anesthetic, only the protonated form, will inactivate the sodium channel. So it goes from inside the cell and then blocks the sodium channel to get access when sodium channel is open state. However, the inactivated state of the sodium channel is the one that the local anesthetic is in most tightly bound to and blocks it. So local anesthetic just block the sodium channel in the inactivated state. So block the sodium channel in the inactivated state and therefore block the signal propagation, particularly in pain fibers. So this ends my report.